I am Professor Dr. Vivek Gaur. I am a maxillofacial surgeon and I am practicing in Kaushambi, Delhi NCR. My clinic name is Simpladent Clinic, and this clinic is specialized for doing a corticobasal implants. Corticobasal implants means immediate functional loading implantology, and we practice and we operate and we do the Simpladent implants. They are the pioneers in immediate loading. They are the first in the immediate loading, and they are from Switzerland. Now when I am talking one-to-one to my patient and explaining the treatment, so I tell actually that yes, this treatment will be done and you will be eating comfortably. So patient asks, so is there any chances there of the implant failure is there? Yes, there is, cannot be 100% success result, cannot be there. So there is a chance of implant failure is there. And what I explain, I tell them, see, I am using a single piece smooth surface implants. These are single piece smooth surface implants, means after placing the implant in a more appropriate manner and the implant in a highly mineralized bone, highly strong bone, then I will be just checking the occlusion, means I will checking the bite. I'm not bothered at all for anything. But when I'm using a rough surface implants, this is a rough surface implant is there. Rough surface means that the structure of the implant is rough. So what happened? There is a probability is there that later on when everything is perfect, implant placement was perfect, bite was okay like or perfect, but there is sometimes the resorption of bone occur. Resorption of pattern is a natural thing is there. When it occur, if occur in my smooth surface implant, even though some part of the implant, body of the implant visible, tissue is never going to react. Tissue actually accept and appreciate the smooth surface implants, the corticobasal implants, implant from Simpladent or actually dental from Switzerland. But if I am using a rough surface implant is there and some of the part of my implant get exposed, then there is a secondary infection can occur. Secondary infection means maybe a pus formation will be there and gradually you can lose the implant. So there is a chance of secondary infection is there, that is called peri-implantitis, and your dentist will pronounce that everything was perfect but unfortunately a disease has occurred, that is peri-implantitis. So what you do to avoid the peri-implantitis? Of course, surgery is very important, planning is very important. Come down actually to the basic. The basic is when you have a smooth surface, polished surface, corticobasal implant is there, even the implant get exposed, there is no chance of secondary infection is there. But if you have a rough surface implant is there are the chance of some rough surface getting exposed and it can create a secondary infection, that is called peri-implantitis.